what we spent the last 5 years building really is a very different kind of insurance company. The healthcare system is, for many people, most of us, I think, frighteningly complex and overly costly. We said we want to start an insurance company where the insurer helps you simplify that experience, connects it up more, connects the dots for you, navigating this complex healthcare system. And what we do uniquely well, I think, and what other partners see in us, like Humana, is that we are able to engage individuals and our members around their healthcare much earlier on and in a much more deep kind of way. We have a very personalized service for people watching over your shoulder as to what's happening with you as you navigate the healthcare system. With the click of a button, you can summon a doctor. About 70% of all rashes of Oscar members now get treated over the phone, etc. And that's a beautiful combination, I think, with a experienced insurer like Humana to roll it out for businesses in the Nashville area.
I mean, people enrolled with Oscar, they have a much greater percentage use of telemedicine, for instance. Right. That's what you're talking about. In terms of the business perspective, though, does it cost businesses less because they're managing the healthcare costs earlier on in the process? How does it benefit the business?
Melissa, the big thing that it does do is attack costs, which I think is probably missing from the debate. And what we think we're uniquely positioned to do with great technology and great member experience is that we can work with partners like Cleveland Clinic and Humana in order to get like-minded integration to drive better outcomes and lower costs.
Does this deal preclude you from working with other HMOs on other deals?
We've got a big landscape of which we can do partnerships, broadly speaking. So this is the very early innings with the early ones, but we look forward to doing more of these kind of things for a very long time.
You've had to pull out of markets, right, because of ACA. It's got too costly to operate in certain markets. When you take a look at what's going on Capitol Hill, we're expecting the latest version of the Republican plan today. What are you looking for in terms of the impacts on your business and how you do business?
A couple of thoughts on this. One is that I just still don't think that people will be crazy enough and frankly suicidal enough to throw 25 million people off their health insurance.
So you don't believe in repeal? They will repeal? I
believe that there will, at the end of the day, without calling the play-by-play, be a plan that continues to cover tens of millions of people who have found coverage since the days of the ACA, and I'm very optimistic about that. I do think that what none of the bills that I've seen so far address really is the fact that the US healthcare system is too costly by a mile. I mean, we spend about twice as much per GDP on healthcare as any other rich country in the world. A bypass surgery costs $78,000 in the US, costs $34,000 in Switzerland, for example. And I want to see some things in that bill that will start addressing that problem. There isn't enough competition in the value chain of healthcare. And I do think if you consumerize this market more, if you put more power into the hands of consumers in the way we have done, more transparency, exactly, and more choice for consumers, you can attack some of the underlying issues. If you, for example, were to give employees the choice of buying a high-deductible plan, you could free up to $150 billion per year in more income to Americans choosing to buy different kinds of plans.
Wow. But in terms of Oscar and its I mean, you're a startup. Essentially, you're looking to expand. When you take a look at what is being proposed, what could hurt you the most? What could help you the most?
Regardless of where the debate ends, we think we're well positioned because people are going to need health insurance. And we think with our technology platform, focused on consumers, we think we're going to be in a position to grow a very big, meaningful business over a very long period of time. So as long as we're stable, I think we'll be fine. And I think that as we focus on investing in innovation, it's with partners like Humana and partners like the Cleveland Clinic that make us super optimistic.
It's a very diplomatic answer. But at the same time, with this debate going on and the uncertainty with healthcare, are you at all pulling in your reins, or are there any markets you're saying, you know what, maybe we won't enter that market because things are a little uncertain right now? There's got to be something.
Yeah. So we are about doubling our footprint for next year. So we are optimistic about even the individual market. In Nashville, for example, we're rolling out Oscar for Business with Humana. We are also planning on going into the individual market because we think it is a market you can actually make work. If you look at, for example, the Texas marketplace, a market where you didn't have Medicaid expansion, the average risk score from 2015 to 16 actually came down. The population that got insured was healthier than the year before. And but there certainly are some markets across the country where that stability hasn't really necessarily occurred, and more work needs to be done to stabilize the markets. I do think if you go 10 years out, US health insurance, US healthcare will look much more like we and others envision it, like Humana envisions it as well. There will be deep integrations in the way we have built them with the Cleveland Clinic, for example, between insurance companies and between hospital systems. There will be more risk sharing, more individualization, more choice, more convenience in televisits, and so on. And so that's what we're positioned well for. I really want to say, let us sell, let us do the work, because once we are in the markets, we will get that viral growth. About 35% of members to Oscar come because friends and family tell them about Oscar. The first companies in New York that bought Oscar for Business bought them because they used to be Oscar members and now run a business. And so as long as we can do our work, I think it will push the system forwards.
Got it.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.